Welcome to Hello Doctor Talks. Today we are going to discuss about diabetic foot problems. To discuss more on this, today with us Dr. Radhika Malireddy. Dr. Radhika Malireddy, DNB General Surgeon, DRNB Plastic and Reconstructive Surgery, Postdoctoral Fellowship in Diabetic Foot Surgery, Consultant Plastic and Diabetic Foot Surgeon, Department of Vascular and Endovascular Surgery, Care Hospitals, Banjara Hills, Hyderabad.
Good morning, everyone. On the occasion of World Diabetes Day, which is on November 14th, the slogan for this year for the International Campaign on Diabetes Day is Know Your Risk and Know Your Response to prevent diabetes and the complications which arise due to diabetes. The various complications which we all know which might come because of diabetes are starting from involving the vision, which is by retinopathy, and including more risk of stroke and cardiac problems, renal problems, and the foot problems. Now we will see today we will learn more about how to prevent diabetic foot ulcers. Before that, we would like to know what is your risk for diabetic foot and how do you respond to diabetic foot. So by this we can prevent many more complications and many limb amputations by knowing what is your risk to get diabetic foot and how you can prevent them.
Doctor, what is diabetic foot problem and why it is significant with the people with diabetes?
Patient with diabetes who get any ulcer in their foot, either in the foot or up to your ankle joint, any ulcer in these patients is considered as diabetic foot, which can occur either because of neuropathy or varying degrees of ischemia or infection, or a combination of all these factors.
Doctor, how does the age of an individual with diabetes will impact the risk and management of diabetic foot problems?
It is not the absolute age of the patient which is important to get diabetes. Any patient with diabetes can get diabetic foot, but it is the duration with the diabetes. Like if the person has diabetes for 1 year, 2 year, 10 years, when the duration with this diabetes increases, the risk for the diabetic foot keeps on increasing. And also the duration of uncontrolled sugars, which matters the most. A person may be only 30 years of age, but he has very uncontrolled sugars for a year or two, and he may not know that he has diabetes. The first thing he might come to know is some problem in his foot. When we see check his sugars might be high. It is the duration of diabetes and the time of uncontrolled sugars which is more important rather than just the age of the patient. And of course, with increasing age of the patient, the other problems like cardiac problems, renal problems keep increasing, which might worsen the outcomes in diabetic foot as well.
Doctor, can you explain the common risk factors for diabetic foot problems?
Any patient who has diabetes and who walks barefoot. Barefoot walking is considered the most important factor which can predispose any person with diabetes to diabetic foot ulcers. Smoking, uncontrolled sugars, and not taking good care of the foot is another important risk factor to develop diabetic foot ulcer.
Doctor, what are the early signs and symptoms for diabetic foot problems?
We see many people saying, I have a corn or callus in my foot, which in general language they call as ane. So whenever any person with diabetes, usually they develop small thick skin at the tip of their toes or below their great toe or anywhere in the foot. When they see these changes or nails becoming dark or toes becoming cold or black or any swelling of the foot or redness or increased temperature. Some people might come to us as well saying, I'm having fever in my foot. When I touch, my foot is very warm. These are all the early signs. Whenever you see these are the early signs to detect diabetic foot.
Doctor, are there any specific diagnostic tests or screening tests used for the early detection of the diabetic foot problems?
It is the clinical examination which is most important to detect early diabetic foot. So you should keep visiting your foot doctor often to check for the health of the foot. And also whenever you feel like you are walking on the soft cotton, or when you think your chappal are slipping from your foot whenever you are traveling or somewhere, then these are the early signs which says that you have neuropathy in your foot. In these patients, when they come early, a simple test by checking the sensation by a 10-gram monofilament wire, when we check with this and assess the sensation. And other most important thing for early diagnosis is looking for the pulse in the foot. Whenever we see patient and there is no pulse in the foot, we might have to do some further investigations to look for the vascularity of the foot.
Doctor, how often should individual test their feet examined with their healthcare professional?
See, any patient with diabetes who never had any foot problem or they don't have any problem with their sensation in their feet, they should visit their doctor once a year. But if a patient has any decreased sensation or anything related to decreased blood supply of the foot, they should visit the doctor at least once in 6 months. For suppose if we have a patient who has lost their toe or any previous foot problems, they should visit the doctor once every 1 to 3 months. These are the guidelines given by International Working Group on Diabetic Foot. So any patient who have had the problem in their feet earlier, they should visit the doctor at least once in every month to 3 months.
Doctor, what are the treatments and interventions are available for the people who are already having a diabetic foot problems?
First, whenever we have a patient with diabetic foot, we should assess what is the main problem. Is it only an ulcer, or the ulcer is complicated with infection, or there is a complication added to it which is in the form of decreased blood supply. We need to assess in these three aspects whenever we see any patient. Suppose we have seen a patient with infection, the main thing for them is to control the infection. It is through a surgical procedure called debridement, where we remove all the infected tissue, start them on antibiotics according to the culture sensitivity reports, and control the infection. And if the same patient has decreased blood supply, then we have to do MR angiogram to look for how the vascularity of the foot. And depending on that, there are new advanced techniques now in the form of balloon angioplasty, stenting, endovascular procedures, where through a small opening in their leg, we can increase their blood supply by balloon angioplasty and stenting. And if the ulcers are because of neuropathy, then how do we identify them? Any clawing of toes, any bent toes causing problem with the ulcer at the tip, we can do a small procedure called flexor tenotomy, where we can correct the position of the toes again and we can treat these ulcers. And usually we see many patients walking around with corns at the base of their great toe. This is also because of the stiff great toe, which we can correct by Keller arthroplasty. All these procedures are called offloading procedures. Whenever we see any patient with trophic ulcer without any infection, they are the good candidates for these offloading procedures, where we treat the ulcer before they get complicated. And by these procedures, we can save the toe, foot, limb, and the life of the patient.
Doctor, what are the steps to prevent diabetic foot problems?
Till now we have been listening about what to do when you have diabetic foot, but the first thing is, we all know prevention is better than cure. Now we will see what are the safe steps to follow to prevent all these complications. First thing is, never walk barefoot. Always use footwear both inside the house and outside the house. When we say footwear, it doesn't mean any casual chappal you can wear and walk. Use either sandal or shoe. And whenever you are buying a shoe or chappal, buy it towards the end of the day, so that any swelling of the foot can be accommodated in that footwear and you don't get shoe bite. And other thing is, always keep your feet clean. Apply moisturizer on the foot, but not in between the toes. Cut your nails regularly, but don't cut them very deep into the skin. Cut them straight across. And don't cut any corn or calluses on your foot yourself. And whenever you go out and come back, check your feet for any injuries, and also the footwear to look for any sharp objects in the shoe, and also the outer aspect of the shoe to look for any glass pieces or sharp objects. And always visit your foot doctor or a vascular surgeon, diabetic foot surgeon, once in every 3 to 6 months to check for your foot health and take prevention steps accordingly.
Hope we have covered all the questions related to diabetic foot problems. If you have still doubts, kindly mention in the comment box.